the healthcare market isn't functioning. Consumers don't think about managing their health. They just expect to be healthy. We increasingly see our role in the ecosystem as one that's more platform in nature. It takes a village to solve these extremely difficult structural issues.
Well, thank you, Josh, for being here with us. You have a pretty unique story in terms of your experience at the intersection of consumer and health. So why don't we start with, your journey and what have you been up to for the last 10 years?
Thanks, Julie. Thanks for having me. I guess to start, my life has been dominated by health, starting at an early young age. I've had a series of challenging medical conditions, and health's extremely personal to me. So for my whole career, it's been about health. It's about improving health for America, both affordability, access, outcomes. And I've tried to do that in a couple of different places. I love CVS. It's where I was once and took a break, came back. Probably one of the better places if you're really looking to have impact with over 110 million patients. And my focus is everything patient and customer engagement, as well as analytics and partnerships. Really trying to figure out how we continue to build the trust we already have to solve real consumer pain points that continue to persist throughout this ecosystem, particularly as it relates to how much things cost, how difficult it is to understand what's going on, to get access to care, to actually navigate the ecosystem, to bring your loved ones into the loop. And we're going to do it through technology, advances in technology now, clearly create a new horizon for us to move things farther along.
Mm-hmm. It's an interesting sort of like boomerang that you did, right? You started at CVS Aetna. You were on the Aetna side of that, right? Yeah, before, and then went to like arguably one of the kind of world's best in class consumer businesses at Meta, and then back to CVS. I'm curious, was there anything that you held as a belief about either health or consumer health? As you sort of made the transition from healthcare to consumer, that changed your mind now that you're back in healthcare?
Yeah. So two things come to mind. I think about, there's one that happened when I first transitioned from CVS to Meta. And that was that consumers don't think about managing their health. They just expect to be healthy. Mm-hmm. And there's so many people in our ecosystem that operate under this assumption that people want to manage their conditions, or they think about improving outcomes, or the premise of a health plan or a health coach is something of interest. And it took really going to a consumer first environment and going back to first principles of research to realize actually none of that's the case. And that's not how people think about their health. They don't manage their health. They just expect to have it. So that hit hard. And I said, okay, well, now I get that. Let's go just build something that addresses real pain points in a less constrained world at a consumer tech first company. And then I got hit with the second truth, which I think is even more painful. And it's that the healthcare market isn't functioning and it isn't rational.
To say the least. Yeah.
So, there are just structural anomalies that have to be accounted for. You have a principal agent problem. You have a high degree of regulation. You have some players, say particularly in the EHR space, that cannot be ignored when you think about innovating. And, above all that, you have this foundational requirement of trust in the role of humans that, makes software eating the world in this context a little more nuanced. And I think that was a hard lesson for a traditional consumer company that builds awesome products, then just try to port that playbook over to the healthcare market. None of the things you learn in economics in school apply in the context of healthcare. So, those are the two that really stand out.
Mm-hmm. Yeah, and you raised a great point. Software is eating the world, but it may be a little bit more slowly and more measured in healthcare. But you were at an institution that's obviously known for kind of move fast and break things, and that's obviously a mantra and a culture that is not, most people don't think is feasible in in the healthcare space. How do you think about speed? Because like we're also living in a moment where the speed of companies growing in the AI era is obviously like completely unprecedented. And we are seeing about that, by the way, on the healthcare side too, with certain businesses that are just scaling at levels that we've never seen before. But how do you think about like balancing, moving fast and like not breaking things? But, is that possible? Like, have you seen people do that well?
So I think the first thing I would do is just like interrogate the premise altogether. Like on the left-hand side of that equation is movement and in moving fast. And what I observe is in most cases, people confuse motion and progress. And just because I got a pilot off the ground in 1 month by no means suggests I set up for success and that actually puts me in a position to scale. And more often than not, I probably just wasted everyone's time. So getting really crisp on the definitions, starting with what is moving fast and what is progress and how do you define it quantitatively provides that really important orientation.
Like what's the impact?
Yeah, and because you often have to rely on leading indicators, or if you're doing true health, it's not as simple as, what are my daily engagement rates and how's that evolving? You got to be really thoughtful about those definitions. And then on the other side of the equation, there's a difference between breaking things, cracking things, denting things, scuffing things. And people don't often talk about it objectively. And people don't spend enough time saying, well, like, what really are the risks? And can we quantify them? And can we align ahead of time on how far we're willing to go and how we're seeking to mitigate things? In most cases, I find that if you actually spend time discussing what would it look like to break something and how you're setting something up so that's unlikely to happen, and how as you go through things, you're going to actively measure the extent of that risk so you can make informed decisions as you go, really goes a long way. So just like starting with the premise, getting crisp on the definitions and using that as an alignment tool. Some more tactical things that are useful and I've observed still on the organizational side, really honing in on who calls the shots. Especially in corporations, there's not great hygiene on, is there a single-threaded owner? How are decisions made? Are we voting? Is there a committee? Is it actually this series where we're all going to like, in a cascading way, seek to get consensus just for, the CEO to ultimately make the call? So to spend time really understanding who the decision maker is, and then to discuss, well, when do you need to bring in other people to make a decision and driving that level of agency so they can indeed iterate, especially when it comes to product development, goes a long way. Beyond that, in those organizational, start in less regulated markets, work with partners. Yeah. Obviously, I have a bit of a bias, but there are real advantages in this space to working with partners. And certainly you have a set of disadvantages if you seek to avoid them. And, I guess just broadly speaking, go fast when it's safe and go slow when it matters.
On that point about partnerships, CVS is arguably one of the most iconic national healthcare brands in the world, perhaps, certainly in the US, which is very rare, actually. It's like crazy to think that there's only like maybe a handful of like actual consumer brands that are recognizable and admired in our space. But, so in some ways, because you have such a coveted brand and position in the market in the minds of consumers, one would think that you hold that so precious that you wouldn't want to sort of quote unquote outsource to other people, like, parts of that experience. What's your framework for thinking about in what circumstances are you willing to, sort of whether it's OEM something or actually like put the brand of someone else's entity like on the experience sort of journey for people who are interacting with consumers who are acting with CVS?
So there are certainly non-negotiables. It's taken arguably 100 years to build the trust and brand equity that CVS has and is counted on across over 100 million Americans. So we don't take the conversation lightly, but at the same time, we increasingly see our role in the ecosystem as one that's more platform in nature. And we appreciate that it takes a village to solve these extremely difficult structural issues. And we're going to need other companies to work with us to get it done. And we're focused on where 1 + 1 = 3.
Mhm.
We have certain assets. We bring certain things to the table. We have the ability to engage rare populations and, all subsets of the healthcare ecosystem in a really affordable way from a traditional, like, kind of CAC to LTV perspective. So that's compelling. What we ask of partners is, do you have evidence? Like, it's going to take a lot of time for us to go do something together.
Mhm.
Like, you can't be selling snake oil. Have you done research? Is it validated? Can we skip past the part of the conversation of, is it real? Does it work? Certainly we all know that, Theranos, right? Like, haunts everyone
Yes.
in the healthcare space. Obviously not
Yeah,
us
one
per
of your
se,
peer
but
organizations. Yeah.
then I think it follows a more straightforward partnership framework. Are there synergies, alignment strategically, a real thesis for how, when these things come together, you do something revolutionary, but increasingly we expect to work with other companies and other partners because we understand that we can't do it all and we don't intend to do it all.
Mhm. That said, you guys are actually one of the most interesting collection of healthcare assets under one roof, like, in the country. You've got, the retail presence, you've got pharmacies, you have a health plan, you have care delivery assets, and there's a theory of the case that by virtue of having all of that under one roof, that there's a lot of things that are so broken about the sort of broader system, in terms of, as you mentioned, like principal agent problems, just like the belligerent relationship between payers and providers, that, again, in theory, under one roof could actually, see a better way to do it. What's been your experience in terms of, like, what actually sort of manifests as a better version of things because you are integrated internally versus things that one would think would be better, but actually, still are challenging?
So what's better? Incentive alignment.
Mm.
It's real, it's material, and it can be only solved in this way. I'll give you an example. For most health plans, vaccinations and medications result in financial loss,
Hmm.
period, right?
Yeah,
Like
it's a loss leader.
the cost of the medical costs associated with a vaccine or even prophylactic medications nowhere near covers the multi-year the multi-year effect of improved disease progression. And it's a real challenge. And it's an example of messed up incentives. That's a real structural issue and is extremely hard to solve without actually bringing entities together where you can manage cash flow at a higher level.
Hmm.
So that's one. Another is, data sharing for the purposes of improved care delivery. There's still a lot more to do there. But the reality is that despite the decade plus of investment in infrastructure in standards, there's far from consistent adoption of standards.
Yeah,
And
and way
there's
too many standards.
and way too many standards and far from inevitably everyone kind of getting in a place where data is being shared in support of a common goal. But under one roof, it is much easier for us to share data to build better consumer experiences and to make our clinical teams in particular more effective with a better understanding of what's going on that's not just based on lagged claims data or other, myopic data sources. So that's real. And those have really made a difference for our consumers and for us as a company. Now, on the flip side, consumer expectations also grow in this environment, and they arguably grow even faster than the extent to which our capabilities are able to meet their expectations. So people walk into CVS and they expect to be able to get a question about something Aetna related or something CVS Caremark related. And I can understand that. as a
Mm-hmm.
consumer. I also call
Want like the
into
one-stop
my,
shop.
into Chase and make a really angry face when they say, actually, I need to have you call the line for the banking business. This is the credit card business.
Mm-hmm.
So we have that problem times 5.
Yeah.
It is solvable.
Mm-hmm.
And we're uniquely positioned to solve it. AI actually makes it much easier. We have an initiative where we're using summaries of interactions across all channels to create kind of memories
Yeah.
and
Context.
ubiquity that can then be shared across channels. So no matter what door you enter,
That's
you
fascinating.
have a great experience, but it does take time to get there. And consumers are impatient.
Mm-hmm. So actually, I want to double click on two things you said. So one is on the data side, because there are so many like holy grail things that, again, everything under one roof, data, liquidity across different parts of a consumer journey that are, either like super hardcore healthcare related or even like retail related seems like, again, a holy grail opportunity set. And yet we have, like, we all saw the Pixel saga that happened with Meta and the fact that like intuitively, me as a consumer, I want things to be personalized. I want information about, who I am to inform what's recommended to me. But we all saw that just like hit a brick wall of compliance and regulatory issues. And, so there's a lot of sort of unintuitive barriers in healthcare to actually leveraging information about consumers to apply directly to their healthcare experiences. Number one is like, is that the case, within CVS? And what are some like examples that you can share about like things that intuitively should be possible if you merge consumer experiences with healthcare experiences, but we need to figure out like how we can actually cross those boundaries and barriers.
Yeah. From our point of view, most of the challenges stem from consumers not being in control
Mm-hmm.
of data that really is theirs and they really should control. So we're investing heavily in creating experiences where it's clear what data we'd like you to share. And even if actually via HIPAA, it's not necessary, we go the extra mile to make sure you understand what we're looking to do and why. And we're always leaning into like, why should you do it?
Mm-hmm.
Like, what's the problem I'm actually trying to solve for you?
Yep.
And that goes a long way. That goes a long way in creating the trust and safety to then make the most of that shared data for the purposes of addressing their pain points and improving experiences. At the same time, because there is not consistent adherence to the different data standards and data sharing frameworks, and you have all this ecosystem of intermediaries that facilitate data sharing. It is still easier said than done to get to that holy grail, and doing it just within our ecosystem is still insufficient when it comes to, what actually consumers would need and expect, particularly on the healthcare delivery side, right? I mean, we have clinics and we do some of it, but the majority of healthcare delivery still happens outside of the healthcare ecosystem. And that's where some of the most important data lies.
Yeah. What and then so you mentioned consumer expectations multiple times. What, like, you guys have such an interesting index on consumers and their demands and expectations and how they're actually behaving. What are some of the things that like you see in your consumer base that people want? And we're in an era where like ChatGPT is teaching like all these new behaviors, and we're seeing so many emergent behaviors on the basis of what they're doing with ChatGPT that are very healthcare related, which is really exciting because it's sort of an indicator, a leading indicator on what they would like to do, with these kinds of tools in their healthcare journeys. What are you seeing in your customer base?
Yeah. And I'm fortunate that we, from that learning from my other company,
Mm-hmm.
also went back to first principles and we're like,
Mm-hmm.
I'm not sure we really understand. So let's really do deep studies here on what consumers want. And I'll try to highlight some things that are less intuitive. Consumers want us to appreciate that 40% of the time they're taking care of someone else. And there's a very real caregiving aspect to care, and very few companies, if any at all, appreciate that and create solutions that allow me to care for my dad, or
Mm-hmm.
to, cut across language barriers, or to figure out how to manage a situation where he's alone and a doctor. And,
Yep.
then we try to understand what happened after the fact. And we're all asking, what did he really remember or not? So that's one interesting area that I think is underrepresented. Another is really at this point how much simpler consumers want the experience to be, and the extent to which they're actually willing to pay for the experiences to be as convenient and as simple as they're starting to expect from traditional consumer brands, say Amazon or Apple. We did research, and it was eye-opening to just have the hard data on how many Americans actually understand what a deductible is and know how to calculate a copay. And oh my gosh, I mean, no one knows, well, it's in network, but there are tiers of network, and even within that, there might be differences in pricing.
Yeah.
So it just really is too complicated, and to the extent you can leapfrog that because maybe you're going cash pay and you're going to work in a different box, that certainly might be an interesting way to address a very real pain point that keeps coming up.
Yeah. What's your take? Because you guys are like, everyone talks about trying to be more consumer friendly and, enabling consumers to shop. And you guys are actually like a cash pay business for like a big portion of how people interact with you. What's your like thesis on like how cash pay will proliferate more across healthcare in the next few years? Because we're obviously seeing a lot of early behavior around that.
I mean, I think we should start with some facts. I think roughly 50% of Americans say that they can't afford a healthcare emergency. They don't have more than a couple $100 in the bank. At the same time, premiums and overall medical expense, like,
Keep
all of
going
a
up.
sudden, it's not like keep going up. It's now growing up at an even higher rate than it was before, perhaps because of some of the advancements in technology. And the adoption of high deductible health plans is now increasing again. So I don't know, the average American is probably working with a $5,000 plus average deductible between individual and family. This does have an expiration date. It is inevitable. And drugs are only getting more expensive. It's wonderful. Gene therapies are wonderful, but there's nothing really to suggest that prices are going to go down. So I do see this exploding. I do see us getting to a place where if I have a $6,000 deductible and I can do something and pay in cash, and because of a cash pay rate, it's 30 or 40% cheaper, it just makes sense. And then, of course, as you know, because of the advancement in LLMs and AI, there may also be a new wave of healthcare delivery providers and technologies that can meaningfully reduce the cost of care. So I expect these things to converge. It's impossible from my point of view to see, a decade from now, premiums over $2,000 and deductibles at this level or higher, and we're just going to keep going status quo.
Yeah, we're at a breaking point.
Yeah. So I subscribe to,
Awesome. Consumers as a new class of payer.
Yeah.
Absolutely. Maybe last question, just, think about, again, like you have such a privileged position being, actually your colleague Shri Shakaturu always says that like the pharmacy is like the one place where you don't have to make an appointment and you get to interact with the, clinician. So you have a lot of like really privileged sort of interaction nodes with consumers. And, therefore you have the opportunity to like really recreate and transform like what that healthcare experience looks like for all of us. What's like, if you fast forward 10 years, like what's your dream like set of experiences that you would want to enable for consumers, given, what you just described on like the economic side, what you also mentioned on like the technology enablement side, and, just like the full potential of all the assets that you have at CVS?
We all have some sort of a health passport, and we've solved identity in this space. And there's some company I trust that through that company, I'm able to access all of my various relationships within the healthcare ecosystem. And not only can I access it, I can take control of the data that I really should own and I want to own. And I want to decide who to share it with. I want to decide if I'm okay selling it. Maybe I can start to partake in the financials of the monetization of healthcare data. And, you know, that health passport, by bringing consumers in the center, may be the only way we really address interoperability.
Yep.
So that's one piece, and that addresses some elements of the experience. But then building on the other question, there's more work to do on payments, consumer payments. The last 10 years of infrastructure have really been about healthcare entities and how healthcare entities interact with each other. But there's no reason why, and this cannot continue to be a market where I can't shop. And, you know, no one knows that actually it matters which emergency department you go to. There's meaningful differences in the out-of-pocket expense. And we just cannot continue to support a status quo where I learn after the fact how much something's going to cost, the extent to which it's covered, and then have to face a predicament where I probably don't even have the money in my checking account to pay for it. Which, by the way, maybe leads to another piece where there is some play for someone to come in and say, I can help you with all the finances of it. You can borrow against your employment. You can buy now, pay later, amortize the cost of this over a longer period of time. If prices are going to be where they are for a while, we have to find some way that it doesn't blow up someone's world when they have an unexpected emergency. But we gotta get consumers in a place where there is real transparency. Some of that's going to have to come through regulation, but that would be a great experience. And then you're never taking out an ID card. You never have questions or surprises after the fact. And you're, God forbid, never bringing back that folder that I think we all have that are my, medical records dating back 20 years that increasingly are questionable in an attempt to just make sure there's ubiquity understanding of who I am and what my healthcare needs are.
Yeah, love it. Well, we look forward to you creating that future for us in your current role. Thank you so much, Josh, for sharing your thoughts.
Yeah. Thanks, Julie.